We've already touched on some of the diseases associated with either over or under consumption of minerals, and now we'll go into detail about a few of these. Hypertension is an elevated systolic or diastolic blood pressure. Optimal blood pressure is 120/80, and increased blood pressure can be a result of an elevation in either systolic or diastolic pressure. It does not require an elevation in both. Hypertension is characterized by a substantial systolic pressure of over 139 milligrams of mercury or a diastolic pressure of over 89 milligrams mercury. 95% of cases of hypertension have no clear cause, and we refer to these as primary or essential hypertension. Secondary hypertension is that which occurs as a result of another disease, such as kidney disease. Hypertension is often referred to as the silent disease because there are not a lot of overt signs or symptoms of hypertension, and it must be measured to be diagnosed. Managing hypertension may lead to a decrease in the risk of cardiovascular disease, poor circulation, kidney disease, and stroke. And we know that African Americans are more at risk of hypertension than other racial groups. There are several causes of hypertension, some avoidable and some not. As we age, our risk of hypertension increases, and though we cannot avoid aging, living a healthy lifestyle early in life and as we age can decrease the risk for hypertension later in life. Family history of hypertension also increases our risk, as does atherosclerosis, obesity, high insulin levels, inactivity, and excess alcohol intake. We do know that a diet rich in minerals plays an important role in hypertension as well. Blood pressure increases with sodium intake, and fluid retention leads to an increase in blood volume. So limiting our intake of sodium-rich foods can be a first step in reducing our hypertension risk. Other suggestions include increasing our intake of calcium to over 1,000 milligrams per day, increasing your intake of potassium-rich foods, adequate magnesium intake, following the DASH diet, or Dietary Approaches to Stop Hypertension diet, that includes potassium-rich and low-sodium foods in an overall healthy eating pattern, and increasing your intake of fruits and vegetables. While limiting or increasing specific nutrients can help reduce hypertension, the most effective means of reducing blood pressure is a simple reduction in weight. Some medications may also be helpful in reducing blood pressure by reducing blood volume and increasing urine output. Other hypertension medications may slow the heart rate and relax blood vessels. Osteoporosis is a result of calcium deficiency and develops over the course of a lifetime. Calcium is deposited in bone in the first 30 years of life, so being sure that children and adolescents have adequate calcium intake can reduce the risk of osteoporosis later in life. Slender, inactive women who smoke are most at risk of osteoporosis, and this disease leads to 1.5 million fractures a year, mainly in older adults. Here you can see a woman with normal bone strength and a woman with osteoporosis. The bones of a person with osteoporosis have less substance, so osteoporosis generally leads to a loss of height, distorted body shape, fractures, and possibly loss of teeth. Monitoring changes in adult height is a key way to detect early evidence of osteoporosis. A curvature in the upper spine can also result from demineralization of vertebra. This can lead to pain in both men and women. We have two different types of bone in the human body. Cortical bones form the shaft of bones and their outer mineral coverings. Trabecular bone supports the outer shell of the cortical bone in various types of bone. Here you can see that osteoporotic bone has much less mass than trabecular healthy bone. This leads to a more fragile bone and is not reversible to any major extent. As we have said before, bone mass loss occurs rapidly, or bone mass accumulation occurs rapidly during adolescence. So this is a time when bone building should occur and calcium consumption is most important. We hit our peak bone mass during our early 20s, at the end of adolescence, and begin losing bone mass by about age 30. This is different depending on gender, race, family patterns, and other genetic factors. Women are more likely to experience increased bone loss after menopause, and it is recommended that they undergo a DEXA scan yearly, which can help to determine bone density and possible osteoporosis. Diet and lifestyle factors are associated with bone status, and suggestions include a diet adequate in vitamins and minerals important to bone health, maintaining a healthy body weight, for women maintaining normal menses, and for all people to participate in weight-bearing exercise. Negative lifestyle factors include excessive intake of protein and other nutrients that may lead to the decrease in calcium absorption, as well as smoking. Here you can see how developing a healthy bone mineral density in early life can decrease your risk of osteoporosis later in life. Strong bones at age 30 decrease the risk of osteoporosis as an older adult.